Are hospitals and doctors inflating the number of COVID cases and deaths that they are treating, that we're seeing in the hospitals, in order to be paid more? I can't believe I'm actually addressing this in a video, but I had to because it's something that will not go away. People continually ask this question, and not only that, but many people are still implying that doctors and hospitals are basically lying about the numbers of COVID cases and COVID deaths that we're seeing in order to be paid more. Guys, this is crazy. And I have avoided talking about this for months because I kept saying, wow, we've got better and more important things to talk about, like how to stop this pandemic. But you know what? This is not going away. Not only that, we now have politicians that are out there spewing these same myths. And this is a myth. And I'm going to tell you why. We're going to break it down exactly why this is not true. This idea of doctors and healthcare systems and hospitals inflating COVID cases in order to get paid more. Now, the first thing you should know is let's deal in facts, because that's what I like to deal in. You know, is it possible for hospitals and healthcare systems to get paid more for patients who have COVID-19? That answer is yes. That is true. And that is based on the CARES Act. This is according to factcheck.org, but the CARES Act created a 20% add-on to be paid for Medicare patients with COVID-19. The act further created a $100 billion fund that is being used to financially assist hospitals. So are there some financial incentives that hospitals receive when patients have COVID? Yes, but that's not the question that was asked. The question that was asked and the rumors that are floating around are that doctors or hospitals are lying about their COVID-19 patients in order to get paid more. And this is why this family doctor, someone who sees patients, who teaches medical students and residents, who comes to you on the airways every day, this is why I say no. Doctors and hospitals are not doing this in my belief. And this is why. First of all, it's fraudulent. Okay? First of all, I bill every single day that I'm in the office. We have to bill our visits. If you lie about that, it's called fraud. You can get in big trouble. It's fraudulent to lie on your billing and coding, amongst so many other things, being a doctor and just being a citizen in this country. It's fraud. You're not supposed to do that, and you can get in big trouble. And I don't know any doctor who's interested in committing fraud. Okay, that's the first thing. Second thing is, by the way, I know a lot of people don't know this, but a lot of doctors I know have actually, in this COVID pandemic, been either laid off or taken pay cuts. Please don't think that doctors are sitting over here, fancy free because it's COVID. I mean, yes, I know that you understand that we're frontline workers and we're being put at risk, but please don't think that the financial ramifications have not hit medical institutions and physicians. I know doctors who have had to close their doors to their private practice, doctors who can't get jobs as locum tenens doctors or doctors who travel to different locations, doctors who've had to take pay cuts, doctors who've been laid off. So, by the way, please just keep that in mind. The next thing is this thing that we call the Hippocratic Oath. We take an oath to do no harm. It's a promise that we make the minute that we get into med school and get our white coats and get started as a medical student. And you know what? I don't know any physician that doesn't take that seriously. We do our best to keep people healthy. We do our best to be honest. At least that's what we're supposed to be doing. And I do believe that most physicians do just that. The other thing I would say is you're asking about the coding and billing. You're saying, well, what if somebody has a heart condition and or a lung condition or a kidney condition and they have that and their conditions are pretty bad, but they also get COVID. Why would the doctor then put COVID-19 on the death certificate? Well, let me tell you how death certificates work. And I can't explain the whole thing right now in this video, but as someone who fills out death certificates, more frequently than I would like to, that's just the nature of being a doctor. On death certificates, you also list causes that may have contributed to the person's death. Meaning, if that person has end-stage kidney disease and other end-stage diseases, you list those. But you may also list COVID-19 because, honestly, and very likely, COVID-19 might have pushed them over the edge or contributed to their death. That is not wrong. That is actually appropriate. And the other thing, by the way, I know so many people are worried about doctors overcounting and upcoding and overestimating the number of cases of COVID and COVID deaths. But the truth of the matter is, and I think many experts agree with this, we're probably undercounting them. Not we as doctors, but the universe, the world. You know why? Because everybody with COVID doesn't go to the hospital. Some people with COVID die in their homes, or they're sick in their homes, and we don't know that they had COVID and they got over it, or they had COVID and they might have died as a result of its complications. Do you see why this doesn't make any sense? You know, as a doctor, when people say, oh, doctors are just upcoding and overbilling and saying people have COVID when they really don't to get more money, not only is it hurtful, but it's insulting. It's like implying that a surgeon would do surgery on a patient who doesn't actually need it in order to have financial gain or some other benefit that they perceive. Do you see how ridiculous that sounds? It's the same thing with COVID billing. So guys, look, when you hear people out here saying that doctors and hospital systems are upcoding, overbilling, overestimating, I'm going to advise you just to keep on walking, okay? You keep on walking and you focus on what's important. And that is wearing our masks, avoiding crowds, social distancing, washing our hands, using hand sanitizer, and looking after our family, our friends, and our neighbors. Guys, please share this video. I want everyone possible to hear this message. And also, if you haven't subscribed to my channel, I invite you to do so. Guys, I'm Dr. Jen Caudle. I'll be back soon.